Burnout in the emergency department. In this video, I'm going to talk about the contemporary issue of burnout in the emergency department. The aim of this presentation is to teach you what burnout is, what causes it, the implications it has on nursing care, and the responsibilities of leaders and new graduate nurses in addressing it. If you are a nurse watching, after this video, you should feel more equipped to handle the stresses that come with being a nurse. If you are a leader, you will learn your responsibilities in reducing burnout and the important characteristics of an authentic and empowering leader. This PowerPoint aims to facilitate visual learners through the use of text, diagrams and pictures, and auditory learners through narration. This PowerPoint is based upon evidence, with the information deriving from a variety of journal articles, trials, literature reviews, and current policies and procedure. So what is burnout? Burnout is a very common phenomenon among healthcare professionals, especially those working in the emergency department. Burnout is described as a decline in physical, psychological, and emotional energy due to excessive or extended exposure to work-related stress. Nurses who suffer burnout experience high emotional exhaustion, high depersonalization, and a low sense of personal accomplishment. They may also experience a low quality of life, a lack of motivation, and feelings of frustration, impotence, and professional dissatisfaction. It can also cause mental health problems such as depression, anxiety, sleep disturbances, and memory impairment. Ultimately, this leads to a drop in performance level, decrease in work efficacy, and a desire to leave their job. This impacts patient care negatively in a variety of ways. A lack of empathy leads to an inability to form therapeutic relationships and impedes effective communication between patient and nurse. Exhaustion and tiredness can lead to an increase in medical errors, such as medication errors, and a lack of motivation can lead to nurses ignoring the needs of the patient. Burnout is a significant contemporary issue because it compromises a healthy workplace and has a negative impact on patient safety. A qualitative study reported that 76.1% of nurses in the emergency department suffer from moderate burnout, 22.5% low burnout, and 1.4% high burnout. Another study proved that each additional patient per nurse was associated with a 23% increase in the odds of burnout. A healthy workplace is one that creates a supportive and safe work environment, promotes health protection in management practices, and manages stress and other mental health issues. Burnout compromises a healthy workplace in that it can cause significant mental health issues and a rapid deterioration of a nurse's physical, psychological, and mental well-being. There are three main determinants of burnout. Firstly, there is emotional exhaustion. This is described as a state of being physically and emotionally exhausted from work stress and includes symptoms such as low energy, fatigue, and hopelessness. 64% of nurses were emotionally exhausted. Depersonalization is the detachment from caring and often manifests in negative behaviour towards others. 38.1% of nurses felt this. And low personal accomplishment, which is negative self-evaluation of themselves and their work. 34.6% of nurses felt this. This can furthermore cause conflict between co-workers, damaging the workplace culture and can lead to bullying or harassment in the workplace. Burnout then consequently affects patient safety in a variety of ways. Stress and tension in the work environment damage workplace culture and interpersonal relationships. A lack of motivation and depersonalization results in a low quality of patient care, and fatigue increases the risk of medical errors. So what causes burnout? Burnout in the emergency department is so high because of its fast-paced, high-pressured and demanding nature. There is often an excessive workload and a high demand for care due to the critical nature of illness. Emergency nurses also often witness disturbing and upsetting situations and will deal with sudden and possibly gruesome deaths. This witnessing of human suffering and the unpredictable nature of work will often cause great stress, emotional vulnerability, and a dampened capacity to handle tough situations. Emergency nurses may also face ethical dilemmas and value conflicts and deal with stressed out and possibly violent patients and families, which can lead to feelings of loss of control, justice, and autonomy. Structural and organisational factors also increase the incidence of burnout and include workload, lack of resources, shift work, poor management, low social support, and understaffing. Nurses will often find it difficult to balance all their responsibilities while maintaining an empathetic and sensitive approach to their work. There are certain policies in place in order to protect nurses from stress. The Australian Nursing and Midwifery Federation's Workplace Stress Prevention Policy dictates that there must be adequate staffing levels and skills mix to ensure that the workplace is safe and without risks to health caused by stress. Risk management must be implemented to assess and control work-related stresses, hazards and risks in all workplace and systems. There is also the New South Wales Occupational Health and Safety Act 2000. This act legally obliges workplaces to ensure the health, safety and welfare of all employees and that they are not exposed to health and safety risks. The New South Wales Nurses Association released Stress Management for Nurses. This is a document which all health professionals can use to discover coping strategies and relaxation techniques they can implement in their daily life to help reduce stress and burnout. There are also employee assistance programs, which all public health organisations in New South Wales must have. These are early intervention strategies that provide appropriate, timely, professional and confidential counselling and referral services that staff can use to identify and resolve any health or work-related issues they may have. Nurses also have access to anxiety clinics, counselling services, relaxation and stress management courses and health promotion units. 2 literature reviews on actions for preventing burnout found that extensive interventions in hospitals had a positive effect in reducing burnout. These include meditation and mindfulness, coping strategies on the problem, emotions, self-awareness and emotional intelligence, developing empathy skills, clinical supervision, job redesigning and training programs, and regular team meetings. Effective leadership plays such a significant role in helping to resolve or mitigate the issues of burnout. Studies have shown that an empowering leadership style significantly reduces nurses' feelings of emotional exhaustion and depersonalization. There are 4 key ways in which leaders can empower nurses and help reduce the occurrence of burnout. Firstly, they can enhance the meaningfulness of work. Often nurses who are burnt out suffer from empathy fatigue and lose sight of the reasons why they chose to be a nurse. A good leader can help by reintroducing the passion and purpose behind the nurse's work, which increases their sense of worth and motivates them to pursue excellence. Secondly, they should encourage nurses to participate in decision-making, as this allows them to express their opinions and challenge their thinking. Thirdly, they should express confidence in nurses' work by complimenting performance and recognising accomplishments, which makes them feel more fulfilled and increases motivation. Finally, a leader should also help nurses to plan and achieve personal goals and provide the required resources needed for their effective performance. This will allow them to improve their skill set and knowledge, reducing the burden of their workload. Leaders should also strive to practice authentic leadership. This is a model of leadership which has been shown to create a positive work environment that focuses on maintaining employee health and well-being. Authentic leaders make educated decisions, encourage open communication, act in accordance with their morals and values, and know their own strengths and weaknesses. Overall, these qualities have been proven to build trusting work environments that create a positive relationship between staff and leaders. Ultimately, this leads to greater employee engagement, greater work satisfaction, empowerment, and a higher rating of quality patient care, as the leader is more in tune with the needs of the employee and thus can provide the necessary resources to achieve work goals. The supportive network decreases the occurrence of burnout and lowers levels of emotional exhaustion. Leaders also play a vital role in advocating for structural and organisational changes that promote a healthy and safe workplace for nurses. This includes adjusting staffing levels so that they are safe, ensuring there is a nursing officer who regularly assesses and reviews staffing systems and updates it accordingly, enforcing occupational health and safety policies, creating positive practice environments with good managerial support and high-quality leadership, and creating mechanisms of consultation, negotiation and shared decision-making between staff and their representatives. There are a series of responsibilities that a new graduate nurse has in helping reduce the issue of burnout for both themselves and their co-workers. Firstly, it is important that they educate themselves on burnout, including what causes it and the possible risks. They can do this by accessing educational resources provided by management or reading evidence online. They should then implement strategies to prevent or mitigate the effects of burnout. They can do this by seeking support, attending counselling sessions, or practicing meditation and mindfulness. A new graduate nurse should be involved in a team setting, ensuring they are diligent in completing their work and assisting team members in completing theirs. By supporting and helping each other out, workloads can be decreased, interpersonal relationships can strengthen, and workplace culture can improve. They must also ensure they remain within their scope of practice and adhere to the Occupational Health and Safety Act 2000 and any work health, place and safety regulations, so that unnecessary harm and stress is not caused to patients, other staff members, or themselves. If a new graduate nurse notices that a co-worker is displaying signs of burnout, they should direct them towards support networks so that they can recover. They can also educate their peers on the risk of burnout, what signs and symptoms to look out for, and how to mitigate the impact. New graduate nurses are also responsible for formally reporting any issues that are causing their burnout, such as poor staffing ratios or conflict in the workplace. They should also give continuous feedback to the team leaders so that policies, systems and procedures can be altered to consider current evidence-based practice and be improved so that they achieve a healthy and safe work environment. Here are the references I used to make this PowerPoint. If you feel like learning more, feel free to click on the links and have a read.